Troytown Hospital is a purpose-built equine hospital. We've been in operation for over 30 years. We have 10 veterinarians and 4 or 5 nurses working with us at any one time. We have a fully operating equine theatre and recovery rooms and a lot of advanced diagnostic equipment such as MRI scanning, bone scanning, digital radiography. We also run fully equipped foal intensive care units and adult intensive care units and are a major referral centre for colic surgeries for the whole of Ireland. This horse is a show jumping and dressage horse, and he's got a lameness problem on his hind limbs, and we've been looking at him over the last few days, and he's had a bone scan, and he's got a problem in his ligaments of his hind limbs. This is where his injury is, in his suspensory ligament. This is the suspensory ligament, and the suspensory ligament attaches at the back of the hock, and it goes the whole way down the leg, attaches on the sesamoid bones at the back of the fetlocks here, and then attaches down onto the pastern region. And the suspensory ligament acts to support the fetlock joint. So when the horse lands and the leg flexes, it is the main structure which is stopping the joint from bending excessively. So when I pick up this leg here, if I pick up this leg and just hold it in partial flexion, and I can press it here, you can see the horse doesn't like it. He's sore on that. So when I press there, you can see, you know, and he lets me touch him all over. He's fairly good otherwise, you know. So what I can see with this horse, he's lame on his left hind limb, and as he trots away, he is taking more weight on his right hind limb, and there is a sort of an excessive dip in his hip area as he trots on his left side, and we can see that quite clearly. We've just brought him into induction, and we've just given him a light sedative, and we're going to put a catheter in him now and prepare him for surgery. He'll be anaesthetised in this room and then brought into theatre. What we've done, we've made a surgical approach onto the back of the hock joint. We've identified the nerve that's damaged, and we've taken it out, and then we'll be identifying the bit of fascia, the bit of connective tissue which is keeping that ligament in its tight spot, and we'll take that out as well. So we've removed the damaged nerve from the area, and we have released the fascia on the back of the ligament to give the ligament a little bit more room to swell. And we're now stitching it up, and we've done both legs because he's affected on both sides. Then we're going to put some bandages on once we've finished stitching the skin and transfer him into the recovery room. So we finished surgery and we brought him into the recovery room now, and he'll sleep off his anaesthetic over the next 15 to 20 minutes, and then he'll hopefully stand back up on his feet. This is a risky period for an adult horse recovering from anaesthesia. Sometimes they can be a little bit excitable and they can try and stand up a little bit too quickly. What we do have is we have a rope on the tail and also a rope on the head collar so that we can steady him as he stands and the anaesthetist will be outside of the room controlling that as he's standing back up. But everything has gone so well so far, so just the last stage now.
Here at Troytown Equine Hospital, in order to combat the challenges that are posed in dealing with lameness issues in horses, we established this MRI unit in order to help us to diagnose the conditions which would have been previously undiagnosable with our conventional diagnostic methods such as radiography and ultrasound. The magnet we've established here in Troytown is a C-shaped magnet, and that allows us to do the MRIs in a standing position, which poses an awful lot less risk for horses, as we don't have to do a general anaesthetic in order to lie them down. The distal limb of the horse is a very difficult area to examine because it's encased in the hoof capsule. Previously, no diagnosis could be made for a lot of the conditions which would affect horses. In this instance here, we can see that the horse was experiencing a soft tissue injury. This injury is not visible on an X-ray. Because of the hoof capsule, it cannot be diagnosed with ultrasound, and because it's not of bony origin, the scintigraph cannot diagnose it. The MRI is the only modality which can definitively tell us the information we need to get in order to effectively diagnose the horse. And once we've made an effective, accurate diagnosis, our treatment can be specific and our outcomes can be improved greatly.
These are the blood donors at Troytown Hospital. This is Remo, and the chestnut is Little John, and both of them are retired horses, and they were show jumpers and dressage horses, and we use them to give blood transfusions. And in the spring, both of them have given this spring have given about 4 or 5 transfusions each to mainly brood mares who can lose a lot of blood following foaling. And hey fella. And the problem we have with horse blood and horse blood transfusion is that we can't actually freeze the blood. If we freeze the blood, then the red blood cells become denatured very, very quickly, and that it becomes actually useless. So we have to take a blood transfusion. So if we have a mare come in the middle of the night, then we drag the guys in from the paddock and we take 5 litres of blood, and we can transfuse it straight away directly into the mare that needs it. And they're both great because none of them have had any reactions, and we make sure we test them and make sure they've got no diseases and no problems that could be a problem for us. And it's great having them on site because we can use them as and when we need them, whenever the emergency arises.
He's just woken up and he's in sternal, but he's having a bit of sense. That's what you want them to just take their time, not to get up and be disorientated. So he's in sternal there, and hopefully when he blows off more of the gas, he'll get up in his own time.